Remember when you first saw yourself on Zoom and you thought, is that really what my face looks like? Turns out millions of other people had the same thought, and that's been driving double-digit growth in one part of the plastic surgery industry that you might not expect. It's not Brazilian butt lifts, it's not lip filler, and it's not even nose jobs. The answer might surprise you. It's eyelid surgery, and the numbers are wild. In the past 3 years alone, there's been a double-digit increase in the volume of eyelid surgery just in the United States, let alone worldwide. The Financial Times called it the blepharoplasty boom, and they're right. In this video, I'm going to explain what's driving this surge, what are these procedures, and why you might want to consider one if you're noticing things around your eyes with the increasing popularity of remote work and being on Zoom. I'm Dr. Kiyan Eftekhari, and I'm a board-certified surgeon specializing in oculofacial plastic surgery here in Salt Lake City. I trained at Stanford and Penn, and I've been doing eyelid surgery for over a decade. In the past 3 years, I'm seeing something in my practice that I hadn't seen in the past decade. And in this video, I'm going to tell you what that is, why I think it's happening, and why it might be something that could help you. Let's break this down from inside the operating room. In this video, I'm going to give you some perspective on what I'm seeing from inside the operating room, what I'm seeing with my patients, why it has exploded in popularity, and what you need to know if you're considering something like this. Because here's the thing, this isn't a trend. This is a fundamental shift in how people see their own appearance, especially with the rise of remote work and increasingly people being on Zoom. And honestly, this procedure can give you 10 to 15 years of results where you're looking more awake, more refreshed, but in a natural and subtle way when the procedure is done correctly. Before we talk about the rise in popularity, let's talk about what I'm actually hearing from my patients. So people come into me for a consultation and they say, people keep asking me if I'm tired or stressed or sick, and I don't feel any of those things inside, but apparently I'm giving that off on the outside. That disconnect where you feel fine and energetic on the inside, but it's not necessarily reflected by your appearance on the outside, can be profoundly frustrating for people. It can cost people opportunities if they work in an industry where youth is prioritized. There's been a recent Wall Street Journal article about this in the tech industry, and it can also cost people confidence when they need to have that presence to be able to lead at work. Here's what's actually happening. The skin around your eyelids is the thinnest in the body. The upper eyelid skin is about 0.5 millimeter thick. That's paper thin. So it's often that around your face, the first place to show signs of aging is the upper and the lower eyelids. Over time, 3 things happen simultaneously. Number 1, that upper eyelid skin loses some of the elasticity, some of the bounce back, and it begins to gather and form over top of your eyelashes and hang down. That's something we colloquially call hooding, and medically we call that dermatochalasis. The second thing that can happen is that the tissues that hold back fat behind your eyes, because we all have fat around our eyes that's normal and healthy, that tissue that holds it back is called the septum, and that stretches and loosens over time, so fat can pooch forward in the lower eyelids and cast a shadow along the cheekbone, which looks like a bag under the eye. Third thing that can happen is that we tend to lose volume in our face over time in a specific pattern. The most common places people lose volume are the temples, which can allow the eyebrows to sag down even further because this outer part of the eyebrow doesn't have as much support. And then just under the cheekbone here in the cheek area under the eyes, if you lose volume there, it's going to accentuate that bulge above it and make that shadow under the eyes even darker. And here's the kicker. For a lot of my younger patients, this has nothing to do with aging. It can be genetics. They'll tell me that their dad had the surgery or their mom always had dark circles under their eyes. And it doesn't necessarily have to do with things that we commonly think about as being related to aging, like sun exposure or squinting. I see patients in their 30s who tell me they've had bags under their eyes since they were in their 20s, and a lot of it is genetic and runs in families. So why is this procedure exploding right now? Based on what I'm seeing, there are 3 major forces in play. Number 1, social media transparency. So the stigma around having plastic surgery is completely gone. With the rise of TikTok and Instagram and people posting their journeys, their before and afters, what they got done in Mexico or Turkey, it's sort of taken that stigma away of like, oh, I should hide my face because I had plastic surgery, which overall is a good thing. You shouldn't necessarily hide if you've had something done. By having that transparency, it sort of demystifies the whole procedure. 20 years ago, you didn't admit that you got work done, but now you get procedure done, You post selfies before and after online and you get hundreds of supportive comments, and overall, I think that's a lot healthier for our society. The second part of this trend that I'm seeing is that the demographics of this surgery have shifted. When I was in my training, people that would come in for eyelid surgery were typically between ages 50 and 70 because of age-related changes around the eyes. Now that's fundamentally changed, where a younger demographic is coming to my practice. The reason they're coming in is they want to prevent the signs of aging, kind of get ahead of it, or something called prejuvenation. They want to address genetic changes, whether that's bags under the eyes, hooding on the upper eyelids, or some genetic asymmetry, and kind of get ahead of it instead of just waiting until they get into their 50s and 60s to have a bigger procedure done. A lot of my patients are saying, I don't want to wait till I look older to address this. I want to try to optimize it now. The third reason for this trend is that I think this is actually kind of a smart long-term solution. So there are some non-surgical things you can do. Botox, which I consider to be very safe and helpful for good skin, and fillers, which I don't consider to be as safe or as good, especially under and around the eyes, because they don't really age well. So you could choose to do fillers, which might cost you $1,000, $2,000 a pop, and get that done. You know, they last about a year, so you get that done every year for the next 10, 15 years. Right there, you're looking at $10,000, $15,000, $20,000 of expenditure. Or you can have more of a one-time downtime and fee where you do an eyelid surgery when you're a little bit younger, have it last 10, 15, or even 20 years, and the math actually might make sense to have the surgery up front rather than to continually have stuff put into your face every year over time, which may not necessarily age well, as your face can show more signs of aging as you get older. Quick pause. If you're finding this valuable, please consider subscribing to our channel and like our content. I break down topics like this regularly, and I try to give you the real perspective from inside an eyelid surgery practice. If you have questions, drop them in the comments. I do read them. I try to respond to every single one. All right, so let's talk about what we actually do in the operating room. Blepharoplasty is precise surgery on the eyelids. It can be done on the upper eyelids, the lower eyelids, the eyebrows, or volumizing some of these areas with something called fat transfer. For an upper eyelid surgery, my goal is to remove any of the excess redundant skin with your eyes closed. Let me repeat that. All of us have to have extra skin on our upper eyelids because when we blink or close our eyes to sleep, it's the upper eyelid that comes down mostly to meet the lower eyelid. So what I do before surgery is I have people close their eyes, and if there is redundant extra skin that I can pinch away without cracking open the eye, that is the safe amount that you can remove at the time of an upper eyelid surgery to improve hooding. You have to leave enough behind for people to close their eyes, and that surgery is done in the natural crease of your eyelid so that it hides the incision. The purpose of the surgery is to still have a little bit of overfolding of that skin kind of tucked up by your eyebrows so that it will cover up the incision line and so that you won't look hollowed out or sort of too lifted in that area. For the lower eyelids, the surgery can be done in a scarless manner where I go in that pocket that you see there under my eye to be able to address the fat, whether I'm taking some of the fat out or using your own fat to kind of reposition that underneath and around the cheekbone so it blends that bag in better. If I'm leaving a little bit of hooding behind, or if I'm trying to give more of a natural appearance, that's something I call a preservation blepharoplasty, and it's an important thing to think about if you're looking for something more subtle. The goal of blepharoplasty surgery is to look refreshed and rested, not done. So with a lower blepharoplasty, there's often no external scar. That used to be the way we did it 20 years ago. Modern techniques have evolved to where we do it in a hidden fashion where you can't see any scar. And if we're lifting the eyebrows, we're usually doing that behind the hairline, so you can't see that either. Many of these procedures can be done under sedation. You don't necessarily need to be put under general anesthesia. You go home the same day and you recover at home. So let's address the two biggest concerns that people have with this surgery: scarring and recovery. Well, fortunately for the upper eyelids, the scar is in your natural crease and it tends to be pretty imperceptible over time. You might notice it a few weeks after surgery, but others will not because of that residual fold that you have that will cover it up. You can also start putting tinted sunscreen or makeup on these areas really right around 7 days after surgery, so that also helps to conceal things as long as you've healed and gotten the go-ahead from your doctor. For the lower eyelids, that is usually done in a completely scarless fashion in that pocket. Sometimes I have to make a little cut at the corner of the eyelid to tighten it to recreate that almond shape at the corner of the eyelid. But that incision heals very well because it's in your natural smile lines, or what we call the crow's feet. Obviously, everyone heals a little bit differently, but the design of these surgeries is meant so that you can heal without a visible scar. The second thing that people get concerned about is recovery. Well, I'm going to be honest with you here. You should plan on having 1 to 2 weeks of downtime after the surgery because of bruising and swelling. There's no way around that. There are things you can do to mitigate that, but there's no way to completely eliminate that. Now, if you're on Zoom, what I tell people is grab some reading glasses even if you don't need them. Because if you put your reading glasses on and maybe if you have a little concealer under your eyes, people are usually going to stare at the frame of the glasses on the Zoom call and they're not going to notice what's going on behind it if you have sutures or some bruising and swelling from surgery. Luckily, the procedure is really not too bad to go through as far as pain and discomfort. 99% of my patients only require Tylenol or maybe Advil after surgery. It's very rare to need something stronger than that for pain. So you're going to be up and about, you can work at a computer, you can do most of the things you want to do short of lifting really heavy things or wearing makeup around your eyes for that first week after surgery. The final result can take a few months, but the results can be really dramatic and yet still subtle to where other people may not notice that you had anything done. One more thing, this procedure is absolutely not just for women. There are plenty of men that get this surgery and that makes up a big part of my practice. I alluded to that Wall Street Journal article recently that talked about men, especially in the tech industry, who are getting the procedure at a higher rate because they kind of have to keep up a little bit to make sure they're not aging out of whatever leadership role or what role they have in that company. So here's my perspective as somebody who does this every single day. The blepharoplasty boom, as the Financial Times called it, is not a fad. This is here to stay because of the demographic shifts that have happened in our society and because of how we look at ourselves on camera and on Zoom so much more than we used to. People want their outward appearance to match how they inwardly feel about themselves. And often around the face, the first part that can create that disconnect is around the eyes. If you're 32 and you've had bags under your eyes since you were 20, that can be pretty frustrating. You may not necessarily want to wait 18 more years until you're 50 to get this addressed, and that's why a lot of my patients are coming to me at a younger age to kind of prevent some of those changes before they become more a part of their face, as opposed to something that they can actually improve in a subtle fashion. The goal is never to change who you are. The goal is to get something that's subtle, natural, and refreshed that nobody else is necessarily going to know you had done, but they're just going to have this ineffable sense that you look a little bit more awake, a little bit more rested. If you're considering eyelid surgery or blepharoplasty surgery, I strongly encourage you to find a board-certified surgeon specializing in oculofacial plastic surgery or facial plastic surgery or comprehensive plastic surgery. Just make sure it's somebody that does a lot of eyelids if you're looking at having this procedure done. Ask good questions, see their results, make sure you're comfortable with the surgeon before you sign up. This procedure is all I do all day, every day. If you enjoyed this video, thanks for watching. I'll see you on the next one.